We turn now to the coronavirus pandemic. The U.S. will soon share its vaccine surplus with other nations. The White House announced Monday it is planning to share up to 60 million AstraZeneca vaccine doses pending FDA approval. Officials say the U.S. will not need these doses in its fight against the virus. Meanwhile, concerns over vaccine hesitancy are mounting as U.S. demand slips. The latest 7-day average from the CDC shows a 20% drop in coronavirus shots since early April. Janet Shanlian has more from Houston.
Tonight, the Johnson & Johnson vaccine is back after being paused almost 2 weeks ago. The single dose going into arms with a warning to women under 50 about possible rare blood clots.
It's still such a low percentage of people, and it doesn't make sense to be afraid of the Johnson & Johnson vaccine.
But hesitancy is a significant issue. A new CBS News poll found 40% of those surveyed said they might not or will not get immunized.
I was signed up for the Johnson & Johnson, and then when everything hit about the blood clot, I have a history of blood clots from medication.
8 million doses of the J&J vaccine have already gone into arms, with fewer than 20 cases of severe blood clots. There's growing concern now about people skipping their second dose of the Pfizer and Moderna vaccines. According to CDC data, more than 5 million people have not gone back. A troubling trend, experts say, may be due to fears about side effects and practical considerations, like not having time off work. There's some optimism tonight. The European Union could soon welcome American tourists. And U.S. officials say normalcy could return here for those fully vaccinated.
If we have communities in the country where we have very high degrees of vaccinations, I think you're going to see very much a 2019 type of a life.
But there's also concern about a surge of hospitalizations in the Midwest, where this Indiana clinic is scrambling to give out J&J doses.
A lot of people are afraid of vaccines, of shots. I think the pause in some ways helped the concerns that they had.
But too many healthcare workers say are still waiting.
Whether it's the Moderna or the J&J, just get it. That's going to save your life.
This is a Houston vaccination site, one of those so-called micro sites that many cities are now moving towards. It's an effort to reach deeper into neighborhoods. As for those CDC guidelines, they are expected to be released tomorrow for people who've been vaccinated, as well as those unvaccinated. Elaine?
Janet Shanlian, thank you. As more adults get vaccinated, there is new evidence of the risk the virus poses to children. Nikki Battiste reports on the alarming outbreak outside of Philadelphia.
Tonight, children account for more than 1 in 5 new COVID cases nationwide. Total infections are down week to week, but there are concerns the pandemic will linger until kids can be vaccinated.
It's always concerning to see this many cases, because even at a very tiny percentage, thousands of children are being infected. Then some of them are going to land in the hospital.
In a Philadelphia suburb, 8 second graders and 2 vaccinated family members from the Penn Valley Elementary School are in quarantine after testing positive for the virus. All are connected to a single classroom.
This is the first time we saw this many cases in a single classroom.
Investigators are looking at whether a more transmissible variant may be to blame. They are also focusing on a classroom vent that was partially closed.
It makes me worry a little bit about just the general parameters of what exactly, if 3 feet and the circulation is enough.
Meanwhile, the CDC has just released guidelines for opening summer camps after many were shut down completely last year. Overnight camps should ask everyone, including campers, to be fully vaccinated if eligible, or to self-quarantine 2 weeks ahead of arrival and show proof of a negative test. While the second graders affected here are under quarantine, they can learn remotely if they feel well enough. The school district says it's offering Pfizer vaccines to students 16 and older starting Friday. Elaine?
Nikki Battiste, thank you. For more, let's bring in Dr. Leo Nissola. He's a physician and immunotherapy scientist. Dr. Nissola, welcome. The U.S. is seeing a drop in new coronavirus infections. The former head of the FDA believes these declines are, quote, really locked in. So what is driving this fall in new cases? Is this trend really guaranteed to last?
Hi, Elaine. I think this is a very hopeful moment that we were seeing right now. The cases dropping as the immunization numbers increase, I think what we're seeing here are threefold. Number one, we are developing immunity against this virus. So our immune systems is developing and adapting to these vaccines and providing us more protection against COVID. So the case numbers are declining, in my opinion, because of that. Number two, much of our elderly population also have been vaccinated. And we can see right now how much this actually counts to the fact that new cases are declining. So more evidence now is building up to the fact that these vaccines actually prevent the spread of the virus. So while all of this is good news, we should also be cognizant of the fact that these immunization campaigns should not stop. So the more that we vaccinate, we should also talk about continuing the vaccination campaigns.
Well, according to the CDC, nearly 8% of people in the U.S. have missed the window for their second vaccine dose. Remind us, doctor, how does this impact the effectiveness of the vaccine?
Well, I think this is a very important point that we should be talking about every day. Not only it's important to receive the second shot in the given time, depending on whether you received Pfizer's vaccine or Moderna's vaccine, but also to realize that this perhaps is not being driven by safety concerns or concerns related to health, but actually, in my opinion, it's driven by social challenges regarding the misinformation campaign around these vaccines online. We pressured tech companies earlier in the year and last year to take more active roles into stopping the spread of misinformation and conspiracy theories. And we have yet to see a robust action to take place. And I'll give you one example. On my Twitter feed yesterday, I saw several reports that were very, very false. And of course, we go about reporting them and hoping that the tech companies take more an active role there. But it would be great if we could spread this message and have perhaps the COVID task force pressure these companies into ensuring that misinformation is not in the way of our freedom.
Yeah, it's really been a difficult challenge because, as you know, there are so many outlets now for people to get their information. So when misinformation spreads like that, it can be very difficult to contain. Let me ask you this, doctor. On Tuesday, the CDC is expected to release new guidance on mask wearing outdoors. Now, it is unclear what that guidance will be, but do you believe, doctor, it is safe to ease mask restrictions at this point?
I think we are right now out of the worst part of the pandemic. We have seen the worst. And I think with more immunization occurring in the count of the millions every day in the U.S., we are seeing the results of this immunization. So I do not think that easing the restrictions around mask wearing is a mistake. I actually think this is what we should be doing, and the messaging around receiving a vaccine should include being able to gather outdoors safely in a small group of people. I am concerned about indoor dining for the unvaccinated, but while you are fully vaccinated and immunized, I don't think that this is an issue at all. I think we should be more clear, if anything, about the benefits of receiving the vaccine, the benefits of our communities being immunized against this virus.
And, doctor, the U.S. plans to share up to 60 million doses of the AstraZeneca vaccine with other countries once it passes FDA safety reviews. Are we in a position to be able to help other nations? And how important is it that we do that?
So Pfizer and Moderna have a strong confidence that we have enough supplies of the vaccine vials in the United States for the U.S. population when combined with J&J's vaccine. So I think this is a smart move. I think we should always remember that this is a global pandemic, and it will take a leadership role from the United States to help these other countries to receive more vials of these vaccines. Because remember, we're in this together. There isn't a global pandemic that will be solved unless every country has been inoculated and immunized against this virus. I think it's heartbreaking to see what is happening to India and Brazil today. So the more the United States can do to help bring aid and relief to these countries, the better it is for all of us.
Well, let's talk about India. It reported nearly 353,000 new infections Monday alone, meaning the country has once again shattered the global record for daily cases. Doctor, what will it take to get this outbreak under control?
It's hard to say because of the restrictions early in the pandemic in India, and I'll bring Brazil because I'm a Brazil national, and I follow that closely because I have so many relatives there. The restrictions in those two countries in particular have been somewhat complicated. So right now, because of these new variants being able to spread more faster and more rapidly, are bringing the number of cases at a point that the healthcare system in both countries is at a breaking point. There are several reports of folks not being able to receive oxygen, not being able to be hospitalized because there aren't hospital beds. And another alarming fact is that over 1,300 children have died of COVID-19 in Brazil alone, and mostly because of lack of access for basic care. So it's really complicated. It's really heartbreaking.
Yeah, it really is so tragic to hear these stories out of Brazil, out of India. Dr. Leo Nissola for us. Doctor, thank you very much.
Thanks for having me.